say about 122 people get affected by tuberculosis every day. And about 27 of them will die.
Our key challenge is missing tuberculosis cases. When we say they are missing, it means we are detecting fewer than expected. So we have a gap. We are supposed to be detecting around 44,000 TB cases annually, but currently we are picking around 15,000. Means there's a huge gap.
That is enough reason for us to be awake.
Over the years, once World TB Day is commemorated, there is no activity that goes to sustain a public health intervention to increase knowledge and awareness of TB in Ghana.
This is one of the reasons why we have the Oral Institute coming on board and coming out with the Know Your Lungs campaign strategy to help us find the missing TB cases.
The Oral Institute Ghana is a public benefit, not-for-profit organization that is working in Ghana with the Ministry of Health to improve its activities towards the reduction of TB burden in Ghana.
It's very complementary to the national strategy.
It is time that we all become aware of the existence of the disease. It is also time that we become aware of the fact that this is a curable disease, especially when it is early detected.
We have decided as a consortium to launch a national Know Your Lung campaign. This is to increase awareness of tuberculosis among the ordinary people in Ghana.
We set up to engage Kumasi and Accra Metro Health Directorates for them to help us identify private facilities within their metros.
Together, we selected altogether between Kumasi and Accra about 49 private healthcare provider centers.
The private sector has a major role to play in healthcare service delivery in Ghana. And so we are looking at engaging them and expanding their scope of services.
After the facilities had been engaged, the objectives of the probe intervention explained to them, and a letter was sent out to them through the same engagement with the Metro Health Directorate to train the staff of these private facilities so that they will know how to manage TB.
They will install what we call the gene expert. This is a kind of shall I say, an analysis that would detect TB if one has in the sputum. Almost 98% accurate.
We are currently collaborating with two other partners, Afro Global Alliance and Ghana TB Voice Network.
Afro Global Alliance, they are the partners responsible for identifying the community volunteers in Accra.
Our TB detectors, which we have been trained, that they are doing community work in terms of health education and awareness, TB awareness, in terms of index case investigations, in terms of treatment support for the cases that they dictate, and even supporting the facilities that they are working with.
TB Voice Network is one of the consortium partners to the Oriam Institute Ghana, implementing the TB Reach project in Ghana. Our basic activity under this project is the community works and activities in Ashanti region.
The two partners we are working with are supposed to mainly be in the community, supervise the community volunteer work. So first of all, they were solely responsible for identifying the community volunteers and also managing them. These community volunteers do not find themselves out of the program because they find themselves where they live, and so it's a normal habitat for them, and then they are easily able to flow.
In Ashanti region, the project is basically in Bantama, Menchia North, Menchia South, Subin, and Asokwa. So in these particular sub-metros, we've been able to identify 48 TB detectors and have trained them on the basic screening, trained them also on contact tracing. We trained them on sputum transportation, as well, and then also train them on infection control as part of the activities.
Moreover, there are supervisors that have been identified by the partners within the communities as well, so they can easily monitor the work the community volunteers are doing.
We've also engaged what we call the Kick TB Gala.
We organize a community gala in one of the suburbs in Kumasi.
It's a community entry activity.
And that's where we really came into contact with the general public.
I'm very happy with the way the coordinators, the metro coordinators are also supporting these TBDs.
The purpose of this campaign is to get into the communities and get to the local people and to tell them about lung health.
Challenges that we are facing is lack of awareness and lack of education about the diseases, because TB is curable.
In terms of the education, the level of education, their knowledge about the disease, that is quite a problem.
Like all social illnesses, you need education. You need to educate the public.
By now, we should have not have a problem with stigmatization when it comes to TB care management. But be that as it may, most people still find it hard making others realize that I'm a TB patient and I'm receiving treatment.
The word tuberculosis is shunned away from.
The main problem is the dying of our colleagues, Ghanaian citizens. By the time we finish this program, about 4 Ghanaians would have died. If that is not good enough to motivate all of us into fighting to solve this problem, I don't know what else can.
This is why, as a consortium, the Owirenkyi Institute is working with Afro Global Alliance and the TB Voice Network to partner with Ghana Health Service to use innovative strategies to find the TB cases in Ghana.
We need to work together to conquer TB.
Let's end TB today.
TB is curable, so it's time for us to end it.
It's time to end TB in Ghana, indeed.